Hi, my name is Mary McQuilkin. I'm a nurse practitioner with a master's degree in public health. And I wanted to put this video together because there's been a lot in the media about COVID-19 testing recently. And a lot of the information has been confusing and at times even contradictory. So I wanted to explain what testing can tell us, what we still don't know about COVID-19 testing, and how COVID-19 test results should be interpreted. There's two types of tests that are being used for COVID-19 right now. There's antigen tests, which are nucleic acid amplification tests that use methods such as PCR or polymerase chain reaction to amplify the RNA of the virus that causes COVID-19 so it can be detected. Antigen tests can be used to diagnose. Antigen testing is also helpful from a public health standpoint because if you have a current infection and the viral RNA can still be detected in your body, that likely indicates that you're still able to spread the virus to other people. We know now that many people with COVID-19 infection don't have any symptoms or may have very mild symptoms, but an antigen test could tell us which people seem fine, but they actually should stay home and not go to work yet because they may still be able to infect other people. We can use them to trace the contacts of people who test positive to find more people in the community who might currently have an infection. A downside of antigen tests is that they only show current infection. So if you already had the virus and you recovered, your antigen test will be negative. Recently, there's been more in the news about serology or antibody testing, which is different from antigen testing because instead of looking for the virus directly, it looks for an immune response to the virus. The antigen tests for COVID-19 are done with a nose or throat swab, whereas the antibody tests need a blood sample. Antigen tests are very specific for the virus that we're looking for, whereas antibody tests, there's a chance that there could be detection of an antibody to a similar virus, like a different type of coronavirus, such as SARS. So it's possible that some of those test results might not be as specific. The sensitivity of antibody tests, meaning the ability of the test to correctly identify people as positive who have COVID-19, is highest near the beginning of infection, but it won't be positive right away. This graph shows the immune response following infection with COVID-19. The x-axis shows days, and then the y-axis is how much of different antibodies are in your blood. So you can see that right at the beginning of infection, the level of RNA is starting to increase. So that means that the nucleic acid amplification test or antigen test would start to become positive pretty soon after a person becomes infected. But the first type of antibody, the IgM, won't start to appear until after about a week. IgM is the type of antibody that your body makes during an active infection. And the level of IgM tends to rise quickly while a person is sick with a virus, and then it goes back down once the person recovers. So a lot of the antibody tests that are being developed and being rolled out for COVID-19 test for both IgM and IgG, whereas some tests only test for IgG. And the reason that people are prioritizing testing for IgG is because that's the type of antibody that confers long-term immunity to most viruses. So your IgG usually doesn't start to increase until about 2 weeks after infection. So if you were to take an antibody test after you had been sick for like a week, your IgG likely would still be negative, even though your antigen test, the nucleic acid amplification type, would be positive. So that helps show why the timing is important for which test is better. And it also depends on what you're really looking for. The antigen tests are used more for the diagnosis of COVID-19, whereas the antibody tests are what people are using to try to look for immunity to COVID-19. Many politicians recently have been advocating for an immunity passport, where if a person has tested positive for COVID-19 IgG antibodies, they would then be able to go back to work and go about their life like normal. But this idea is based on three assumptions. And if any of these assumptions turn out to not be true, that idea falls apart. The first assumption is that if you get COVID-19, your immune system will make antibodies against the virus. We know a lot of people with COVID-19, especially young, healthy people, may have very mild symptoms or may have no symptoms at all. And there's some evidence that these people may not be developing many antibodies against the virus. Our immune systems have a way of fighting off infections without having to make specific antibodies for that individual virus. All the time, our blood has cells in it such as macrophages, which you can think of as being little Pac-Men that are gobbling up bacteria and viruses in your blood all the time. And if those types of cells in the immune system successfully fight the COVID-19 infection in a healthy young person, then they won't make very many antibodies that are specific against COVID-19. So we don't know if that same person gets exposed to the infection again, if they'll have any protection, even if they did actually already have it and successfully fight it off. The second assumption is that if you have antibodies against COVID-19, then you can't get it again. So related to what I was just explaining, we aren't sure if that is true at all. And if it is true, we don't know how long that immunity may last. Based on some of the other types of coronaviruses that have been around longer, we expect that immunity may last about a year, maybe up to 3 years. But based on other coronaviruses, it's very unlikely that infection with COVID-19 will confer lifelong immunity, which many politicians have assumed to be the case. There have been some case reports out of South Korea, for example. There were more than 90 different patients who did have COVID-19, tested positive, and then were recovering, tested negative, and then tested positive again and got really sick. So we have not a whole lot of evidence to work with at this point still, but there is some evidence that that may not be true. People might be able to get COVID-19 more than once. The third assumption is that if your COVID-19 IgG antibody test result is positive, that means that you do actually have these antibodies. That sounds like a no-brainer, but it actually isn't. With any type of test, even if the sensitivity and specificity of the test in a research setting are really high, when you use a test on a real population of people, the accuracy or how that test performs in real life can be much lower. And that relates to the prevalence of the disease in the population and a number of other factors. In the rest of this video, I'm going to explain assumption number 3 because that's the least self-explanatory.